I thought I would go ahead and do a video and talk to those who are brand new on this journey. You are absolutely brand new. You've had your teeth extracted. You may have immediate dentures, also known as healing or temporary dentures, or you may not have dentures at all because you just had your teeth extracted and you're going to be waiting to get your permanent, not to be confused with implant dentures, but permanent dentures, that first set of dentures that you get once your gums have fully healed. For people who get immediate dentures, they get their permanent dentures anywhere between 6 and 12 or even 18 months after extraction day, but they have those healing dentures for that time frame before they get their permanent dentures. And some people don't get dentures at all until months down the road and they're navigating things without teeth. And that can have quite a lot of challenges. Also, healing dentures in themselves have a lot of challenges. So I thought I would do a video and talk to those people who are brand new on this journey. Unfortunately, this journey is not a one-size-fits-all journey. It would be really great if it was, if everybody who get their teeth extracted and get healing dentures experience the same exact things all across the board. People who get their teeth extracted and don't get healing dentures and wait and live without teeth for several months all had the same experience. Unfortunately, that is not the case. So it can be very frustrating because you might see someone who is having a really easy time of it. They're not struggling. They have their healing dentures. They put them in, they sit down, they eat a meal within a couple of days, and they're fine. Or they don't have teeth and they're just eating whatever they want, even with just their gums, and they're fine, and you're struggling. And then you're wondering, why am I struggling? What's wrong with me? There's nothing wrong with you. Everybody is going to be completely different on this journey. Or you may see people's experiences where they are struggling. They are not doing well, and it's struggling, and just all across the board for them. And you are reading their posts or watching their videos, and it is scary because you are afraid that that's going to be you. It might have even held you back in getting your teeth extracted because you are afraid that you are going to struggle. But please keep in mind, everybody is going to have a completely different experience. This is not a blanket experience. It's very important to approach this journey in the same manner that you would if you had a prosthetic limb. If you had, for example, your leg amputated, you would know that there's going to be a healing process while that area is healing, and then you're going to get your prosthetic leg, and you are going to have to take a lot of time to adjust to that new prosthetic. Now, some people may be fine when they get their prosthetic limb, doing all of the things that they need to do pretty quickly, and other people may need a lot of physical therapy. People without teeth who get prosthetic teeth do not get physical therapy. We don't have anybody teaching us how to use our dentures. We don't have anybody explaining to us how to keep them in without adhesive. We don't have anybody talking to us about the healing phase. A lot of people are just handed their dentures, and it's kind of like a good luck, see you later kind of scenario from the dentist, and they aren't explained about what the process is going to be because everybody has a different experience, and dentists don't often think about it as not a unilateral, thinking faster than my mouth is maybe. It's not a unilateral across the board journey, and dentists don't often think about it. They might see people in their practice who struggle, for example, with their bottom denture. So they tell their new patients, you're going to struggle with that bottom denture. Not everybody struggles with the bottom denture. I don't. When I don't have adhesive on my dentures, I'm fine. I've done videos where I don't have adhesive. You can see my bottom denture stays exactly where it needs to be. And I talk normally. I've done videos where I've eaten without adhesive and everything is fine. But they go, you're going to have trouble with that bottom denture, because their patients that are coming in are telling them that they are struggling with the bottom denture. So a lot of times the patients that are having success don't come back to the practice because they don't need to see their dentist anymore. So the dentist is going to share those negative experiences over the positive experiences. When it comes to learning to use your prosthetic teeth, it's a lot of trial and error. It really is. when you can't use adhesive during that healing time, you have the dentures and they're there, but they're oversized because they have to accommodate healing gums. So your gums are swollen, your dentures are big to accommodate the swollen gums. Then, as your gums shrink, you have these dentures that are too big for your gums because your gums are shrinking. So you either need to go back to your dentist for a soft reline, or you can do it yourself. Our products, Cushion Grip and Denture Fit, are two of the products. They are do-it-yourself home reline kits. There are Denture Fit is silicone and Cushion Grip is a thermoplastic. Both advertise as adhesives. They are not traditional adhesives, and that they do not adhere to your gums and also to your dentures. And you can remove your dentures just fine, clean them with those products on them, and you can even use adhesive on that product. In some cases, some people struggle with using adhesive. I've never used either of those products because for me, my dentures fit so snugly without adhesive that if I used a product like Cushion Grip or Denture Fit, my dentures would not fit right. They would have too much stuff in there because my dentures fit really snugly. So I've never used those products, but I do know people who have. So your dentures are not all, like today they can fit great. Tomorrow they might not because overnight your gums may have shrunk. And then you also have, while that you're healing, you can't use adhesive at all. Some people use Seabond strips, which are paper strips that keep your dentures in. But even then, you need to be very careful using those because if you have sutures from stitches, you risk pulling those stitches out. You don't want to do that. So you can't use adhesive. What do? You have to kind of figure out how to keep them in. And you have to use your tongue to do that. You kind of got to hold your tongue against your bottom denture to kind of hold them in place while you're eating. I know it sounds like it's a challenge, and it is, but it does get better. And eventually you can use adhesive, which will hopefully hold your dentures in place. If not, soft reline, do it yourself, soft reline. If your dentures are causing you any kind of pain or discomfort, you need to bring that to your dentist's attention. That means that your dentures need an adjustment. If they are digging into spaces, causing sores, please get that looked at because that's a problem. So you have that going on. You have to learn how to keep them in. A lot of people don't want to use adhesive. I'm going to tell you right now, there is no shame in using adhesive. I use adhesive. Absolutely, 100%. I don't need adhesive. It is not a need. It is a choice. I like forgetting about my dentures when they are in. I don't apologize for it. I don't mind adhesive. I don't feel like I need to be ashamed that I use adhesive. It's what I use. It's what I keep them in. I don't have to think about my dentures at all when they're in. I put them in, and that's it. And I like that. I like that convenience. Back in the 70s, the slogan for fixing it was fix it in and forget it. And that's exactly what I do. I fix it in, and I forget about my dentures while they're in. If I didn't have to take them out to clean them, I would never, ever think about my dentures, not even a little bit. So then we've got that. We got to learn how to eat. That can be a little bit of a challenge. What are the challenges when it comes to eating? Chewing. Because if you are not using adhesive, if you only chew on one side, your dentures are going to rock. If you take a bite from the front, your dentures are going to rock. You might even pop your top denture down because you're putting that force, and it might pop in the back and come down. And so you have that you're trying to kind of learn. You have to figure out where your personal bite points are. For me, that's right here. So if I don't use adhesive, I know I have to bite here so that my denture doesn't rock. When you're chewing, you need to chew on both sides. Tasting can be challenging. And it bugs the holy heck out of people because they feel like they have lost their ability to taste. And you lose a little bit of that. We have taste receptors on our gums. We have taste buds on our hard palate. Less taste receptors on our hard palate than our soft palate. But because our food and drinks touch our gums and our hard palate, that's where we miss it. We miss it the most because that's where food and drinks touch first. So when those areas are covered up, it causes issues. What you can do to help with that is let food linger just for a couple of extra seconds on your tongue. Really good thing to do is make sure your tongue is clean. Scrape it, brush it, scrape and brush it, but keeping your tongue clean is very helpful in tasting what you eat. So let food linger on your tongue just for a little bit. Push food and swish liquid up to your soft palate. As you're chewing it, just kind of push that chewed food up to the soft palate. Swish liquid up to that soft palate, saliva and drinks. Also, let saliva and liquid that from your drinks touch the side of your cheeks. We have taste receptors on our cheeks. We have taste receptors, taste buds on our tongue. We have taste buds on our soft palate. We have taste buds and receptors at the back of our throat, on the epiglottis, and also on our upper esophagus. So there are ways to taste. It just takes a couple extra steps, kind of like wine tasting. You know, you do that sip and kind of do the swish and let the wine touch all of the areas of your mouth. That's what you need to do with your food, drink, and saliva from now on, just together. And yeah, it takes a little bit of practice, but eventually you'll get the hang of it. You'll be able to do it with no problem, and it'll be very quick. Nobody's going to notice that you're doing it. I do it all the time when I eat and drink, and nobody pays attention to it. And so let's see, eating, tasting, getting used to your dentures, and also getting used to your new you all the way around. The you in the mirror with no teeth, that can be kind of daunting at first because you're seeing a new you. So there's that. And then also seeing yourself with your new dentures, because you know what you look like before. Now your teeth look completely different, and you are very aware that they're fake. They are not real, they are not yours, and you are pretty sure that everybody around you knows that your teeth are not yours. They're not paying attention. Maybe you're paying attention to other people's teeth, which also makes you more hyper aware because you are paying attention to other people's teeth. So you wonder if other people are paying attention to yours. People with natural teeth don't really pay attention to our teeth unless they're not good. If we have failing teeth, everybody notices, but very few people notice great teeth. So I'm going to say in this case, it's you. It's definitely us over them because we know what we look like before. So we're a little bit more aware, and that can cause issues. It can take several months before you fully adjust to the new you. So keep that in mind and just treat this journey like you would if you had a prosthetic limb. Be patient, kind, and understanding with yourself. Practice eating, practice talking, practice smiling. These are all new things that you have to get used to with prosthetic teeth. So it's a process, but it's very important to be patient, kind, and understanding with ourselves, and to celebrate every single goal that we reach, to not beat ourselves up if we don't achieve the goals that we set. Just take a step back, try again later, maybe a couple days down the road or whatever. I will say it is critical if your dentures are not causing you pain and discomfort, if they are not flopping around and in need of a reline, wear them. It is very, very, very important to wear your prosthetic teeth as much as possible. It is not going to help you if you are taking your dentures out as soon as you get home because they are bulky and you just don't want to wear them anymore. You just want to get them out. Wear them for as much as you can. Do not take them out every time that you eat. If you keep taking them out to eat because it's easier, you are not going to adjust to eating with them. If they are causing you pain, if they are causing you discomfort, absolutely get that checked out by your dentist. You need an adjustment. If they are too big, not even adhesive is working, you need a reline. Those are very important things. But if it's because they are bulky and because they just don't feel natural, they are never going to feel your new normal. They're never going to feel that way unless you are wearing them. I don't notice my dentures when they're in. Right now, not paying any attention to them. Obviously, I know they're there because I can touch my palate with my tongue. So I feel that plastic, but I'm not paying attention to them. They're just a part of me at this point. They don't feel bulky. They're not bothering me. They're a part of who I am. And eventually your prosthetic teeth will feel like a part of you, but it's going to take time. The more you wear them, the more they are going to feel like they belong. If you're constantly taking them out, if you're not eating with them and they're not causing you pain, discomfort, or flopping around all over the place, and you're just taking them out for the ease of it, you're not going to adjust to it. So I just wanted to pop in, talk about all these little things, and I'm going to go ahead and go. This video is just a little bit longer than I wanted it to be, but that happens. Sometimes there's a lot of things I wanted to cover. I don't think I left anything out. I'm going to go ahead and go, and I'll talk to you later.